Good morning. I'm so happy that we are able to meet today. I know you have been experiencing some increased pain in our exercise management program hasn't been working as well as we hoped it would be. So let's talk about some options for decreasing that pain. So at this time, I think Remicade is going to be our best option. So to kind of explain what's going on with your rheumatoid arthritis or RA right now is your body has an increased amount of TNF alpha proteins. And so you have just a lot more running around your body. Your body's kind of overcompensated and they have started to attack your own body cells. So, like you know, RA is an autoimmune disease, so that's why you're feeling all that pain and you don't really feel well as it's attacking itself. So we really want to work on slowing down or halting this behavior, and we also want to halt any radiographic damage that might be happening to give you the best quality of life possible. So how Remicade will remedy this is by blocking this large amount of TNF alpha protein. So it's going to kind of dampen it so that your body can go and kind of go around its normal business and work as well as possible. How I'll administer Remicade to you is through infusion therapy. So it's okay. I know there's a needle. I'm scared of needles too, but it'll be okay. So we'll have a very proficient and very nice woman who is going to be giving you infusion therapy. So what that is they're going to place just a little needle in your arm, and then for about 2 hours, you'll sit and receive Remicade. How this dosing schedule will work is we need to kind of front load the dosing. So that means you'll come in once every 2 weeks for 3 times. So after this 6-week period is over, then every 8 weeks or 2 months, you'll come in and get an infusion. So each of these infusions lasts about 2 hours, so it's a great way to catch up on some TV or watch a movie. Bring some blankets and be really comfortable and just kind of enjoy it as much as you can. I know it's not super fun, but it will make you feel better, and that means you can start going back on those daily walks with your dog. So most of the time, I also will be prescribing to you methotrexate or another type of drug, and this kind of reduces the amount of side effects and those not so fun things that you might otherwise be experiencing, and just helps you feel as well as possible. So during the infusion process and then shortly afterwards, we will have you stay and we'll just be monitoring you for side effects. That way we can intervene as quickly as possible and again make sure that you feel as good as possible. So we do need to talk a little bit about the side effects because there are some, and I want to just make sure that we're both on the same page and that you feel super comfortable with Remicade. So there are a number of serious side effects that we want to make sure we avoid at all costs. So this is a great time to remind me if you've ever had tuberculosis, active or latent. So have you ever had a tuberculosis test that was positive? Okay, well that's great that you have not, but we're still going to do a test just to make sure, and then we'll treat that before we proceed with Remicade just to make sure that you're as healthy as possible. Likewise, it doesn't look like you have a history of hepatitis B, which is great because if you were a chronic carrier, then we would have to do some more testing to make sure that Remicade is the right fit for you. Also, people have experienced serious infections caused by viruses, fungi, or bacteria that spread. Those are opportunistic infections that do take advantage of your lowered immunity because of your RA. So anytime you think you might have any little infection at all, do not worry, you're not bothering me. Please let me know, and that way we can make sure that you feel as healthy as possible, and we can avoid any of those serious infections. If you had worsening congestive heart failure or liver issues, this would also be something for concern. But at this point, you're in tip-top shape, and I'm so happy that you've really been adhering to that workout regimen because your blood pressure is as good as new, and it's pretty great at this point, so we're really happy about that because increased blood pressure is something that does happen in a variety of patients. Some things to look out for, any changes where you think you might be having some type of nerve damage. Nerve system disorders do happen in a variety of patients. as well as autoimmune disorders. So anytime you think you might have some lupus-type syndromes or you feel just a little under the weather, again, call me and let me know, because common side effects are those lupus-like syndromes, allergic reactions, hence why I don't want you to wear any perfume or anything that might irritate your skin, psoriasis as well. So a lot of those things that you have already been looking out for, I just want you to make sure that you're still looking for any changes in your normal behavior or anything like that, any worsening of any issues that you already have. Some common side effects from the infusion therapy itself are respiratory infections. Again, any infection, anytime you feel under the weather, let me know, because we're just going to be monitoring that extra closely. Also, stomach pain. Again, why we want you to eat well. Don't try to skip a meal or something before you come. It will just make you feel more under the weather. We also have some people who experience fever, chills, chest pain, increased blood pressure, shortness of breath, rash, and itching. So all of those things are why we'll be monitoring you throughout the infusion process. Now, don't worry. I think Remicade is going to be the right fit for you. As I said, a lot of these possible side effects are not things that you are already predisposed to, so I think we'll have a good shot at Remicade, but I will be monitoring you throughout the process, and we can adjust your dosage as needed. Now, do you have any questions? Do you want me to explain anything at all? Okay, awesome. Yeah, I'll give you some information about Remicade if you want to read about it, and share it with your husband and family, and then we can start figuring out a date to start the Remicade infusion process. Okay, awesome. Thank you.